respiratory, however you got it named. Yeah.
Okay, perfect. Let's go through this one here. Okay, work me through this one here.
Okay. So 55-year-old smoker.
So read the question first for me.
Sorry. Histological findings present in the patient's bronchi.
Perfect.
Okay, so we got wall destruction. Okay. So 55-year-old smoker, persistent persistent cough with yellowish sputum past 3 months. Similar episodes over the last 2 years, so it's more chronic. Coarse breath sounds and wheezing. So it's sounding COPD, which would lean towards A, kind of like COPD, emphysema type things. Eosinophilic, I don't think so. Fibrosis doesn't sound quite right. You can get hyperplasia, like cancers with smoking, but I don't know the yellowish sputum if that's quite what I'm thinking. I think cancer, I think more blood. And
Okay.
then I don't think about granuloma either. So I'd go with A.
Okay, so more goblet cell because you're gonna end up with yellow sputum, chronic bronchitis, right? Inflammation of the bronchi, mucus production, etc., right? Wheezing. So let's talk about this. So, I mean, you can get COPD related to smoking.
Mm-hmm.
I'm trying to think of what you can distinguish because I knew that it was between these two. So,
Mm-hmm.
but oh yeah, yeah. The key here is that the issue that they're telling you about the sputum, right? So I like kind of what you're saying about the COPD, and he probably has a little bit of kind of COPD-ish pictures with the coarse breath sounds and wheezing, of course.
Mm-hmm.
But better thing is looking at his chief complaint. That's going to be key. Your answer is not incorrect because he does have symptoms of COPD, but does it
Mm-hmm.
make sense that his chief complaint is he's talking about coughing of yellow sputum? So I would lean more towards the goblet cells due to the fact that he's producing a lot of
Extra mucus.
exactly extra
Gotcha.
mucus. But definitely for sure, alveolar wall destruction COPD, right? Is a great answer here, but I think a slightly better one is goblet cell hyperplasia, just due to the chief complaint that they're talking about at the beginning.
Okay. That makes sense. I guess my thought was if he has had, this is probably like very early signs of lung cancer. I guess when I was seeing hyperplasia, I was thinking more cancer, and I think would be more like weight loss and
Yep,
fatigue. You start getting
gotcha.
all those symptoms. But I guess if it's just talking about purely just goblet cell hyperplasia, it could be very early on, and you wouldn't have those symptoms yet. Yeah.
Yeah, exactly, exactly. And talking about lung cancer, that's a good point that you bring up. What kind of, when you're smoking, what are the most kind of prevalence of lung cancer that you're talking about?
So small and squamous, I think, would be the most
Yeah,
prominent, especially for a older man who's had a history of smoking.
exactly. So on histology, you expect if you're thinking a little bit more of a cancer standpoint, then you're going to get
Hmm.
squamous cells or those small cells more likely, right?
Hmm.
So this hyperplasia is just mucus producing cells. That's about it. And that happens with all smokers. And there's a combination of both when you're a smoker, COPD, and obviously, a lot of mucus production, of course.
Yep.